Hey, Karina.
Hey, how are you?
Good. I'm gonna do some. I'm gonna do the icebreaker. I'm gonna put the icebreaker in chat, and maybe
Okay,
people can start putting their restaurants.
okay.
Do my text make sense, Karina?
Okay, I'm finna look at it because I can't see.
Okay. I didn't know if I didn't want to sound cranky. I was just saying I want to try some other things first.
That sounds good.
Okay. And Jackie actually put it in her email blast to all the people who work with those system of care sites. So I thought that was really good about
Okay.
signing up for our email list.
Oh, okay. Okay.
Hey, you guys. We're starting with an icebreaker. I just put it in chat. I didn't realize we had more people in here. I was just chatting with Karina. But welcome, everyone. And we've got an icebreaker started in the chat box. This must not have a waiting room. I know it's still a few minutes early. For those of you who are coming on, we have an icebreaker going on in the chat box, a question. Oh, okay. And we already have one person who's leading the way on answering. We're asking about everybody's favorite restaurant, since we're all probably one way or another thinking about them, since delivery, to go, or getting to go back to one. And what's your favorite restaurant and what you like when you go there? And I'm reading about nukes or bug shots. And Shannon, you've got me curious about the melting pot now. I'm going to put mine in. You're making me hungry. And welcome, welcome to those of you who are coming on. It's not quite time to start yet, but we have an icebreaker going on in the chat. And of course, you can share whatever you want in chat, but we're also asking people to share their favorite restaurants, since that's probably something on everybody's mind right now. And then what you most like to get when you go to that restaurant. I should have eaten before doing this webinar because I'm reading the responses and getting hungry. Hey, I see we have quite a few people coming on, and I was just sharing with the others. We're doing an icebreaker right at the beginning. We probably, one way or another, most of us have had restaurants on our brains recently, either through delivery or curbside service, or if you're thinking maybe you'll be going back to one soon, or maybe you already have. Just everybody to share what's your favorite restaurant and your favorite thing to get there in the chat box. Okay. And we also have some sharing in the question and answer, so that's fine. Just Okay, on the question, I know I can see the questions and answers. Can y'all see them? Or does it need to be in the chat? I think if these answers go in the chat box, everyone can see. And I'll read the ones in the question and answers. And for those of you who are just coming on, we're doing an icebreaker as we get started, and asking everyone, oh, and I did get a text. If everyone can share in the chat box, I know there's questions and answers. If you do questions and answers, I'm the only one who can see it. But if you'll go to the chat box and we're sharing our favorite restaurant, which has probably been on everybody's brain, either through pickup or delivery or even getting to go back there pretty soon, your favorite restaurant and your favorite thing to get when you go there. And then in the chat box, you'll see you can either mark all panelists and attendees or all panelists. If you can address your comments to all panelists and attendees, that way everyone can see them, but I can share the ones that just went to the panelists. And I said this earlier, but I think I'm learning that in using this as an icebreaker on a webinar, I should have eaten before the webinar. Y'all are making me hungry. Okay, and y'all can keep responding to the icebreaker as we begin. I really want to welcome everyone, and we've got quite a few people on. I think we will probably have some more coming on as we go along, and y'all can see what everybody likes. There's some really good stuff on here. That looks yummy. It's hard not to be distracted by it. So y'all can keep sharing, and I'm just going to start the first part of the webinar. I want to welcome you all. I'm Joy Hogue with Families as Allies, and this is a series of webinars we're doing throughout May. We actually started these Friday webinars in April when we all started being at home more. And it's our apart but not alone series that even though we are physically apart for the most part now, that nobody is alone, and we don't want anyone to feel alone. And then when May came around, we knew it's Children's Mental Health Awareness, or it's Mental Health Awareness Month, and this week happens to be Children's Mental Health Awareness Week, and yesterday was Children's Mental Health Awareness Day. We wanted to have some webinars that were really focused on what all that means. And so we've focused this series of webinars this month on what it means to have a really family-driven system of care where we all work together for our children. And we're talking about different aspects of that every Friday in May. So I appreciate everyone being here today and sharing your thoughts, including all this yummy food you're sharing about. Okay. And you'll notice at the bottom of this slide is our contact information. Well, our website, our phone number, and then if you would like to join our email list, which we certainly hope all of you will, and many of you may already be on it because that may be how you found out about this webinar, but we are getting out a lot of information, particularly during this crisis time, that we hope has a lot of helpful resources, both for you, for families, for anyone that you're working with, that you can share. And if you're not on our email list, you can text family19 to 22828, and that will get you on our email list. And we always like to share with you the goals for a webinar so that you'll know what we're committing to share with you, and also so that we can reflect back at the end and see if we met those goals. And I am going to read through these just so that we're all on the same page, that you'll be able to describe. Well, let me go back. This webinar is about family-driven practice, which is a term we use a lot at Families as Allies. And sometimes people are like, what are y'all talking about? What exactly does that mean? So what this is about is what that means and why it matters when we're out there doing work. Our goals for this webinar are that those of you all who are participating will be able to describe what family-driven practice means. And you'll be able to identify at least 3 practical, and we really mean that, practical ways that family-driven practice matters. And that you'll be able to distinguish between family-driven practice and other concepts that it often gets confused with. We also start our webinars with just a brief overview of us for those of you who may not be familiar. And also we always want to keep ourselves on track with our mission and vision and make sure that we're everything we do reflects back on that. So we are the only statewide organization run by and for families of children with behavioral health challenges in Mississippi. And we define behavioral health challenges quite broadly. That could be traditional mental health challenges. It could be situations that children have been in that like really traumatic situations that have led to challenges with their behavioral health. It could be having a behavioral health challenge, could be dealing with another disability and its impact on mental health. It could be a wide range of things. And then we've also started looking more at how to support families of very young children to make sure that their children have every opportunity for their behavioral health to be as positive as possible. So we support each other as families, and we do a lot of parent-to-parent support, both individually and in groups. And then we work together to help make things better for our children. And that's often at the system and policy level. And one way we work together is through training opportunities like this that include families, people providing services to families. And I think I saw we have at least one state senator on the phone or on the webinar. And we really, really appreciate that because it makes such a difference when policymakers get involved in this work too and understand the things we can do at the system level to make things better. Our vision is that all children, not just ours, will have the opportunity to reach their potential and succeed. And our mission is that families are partners in their children's care. And sometimes people, when we say that, think that means we go around trying to make families do stuff. That's not what we mean. What we mean is that the system of care, which is all those entities and systems out there that are working together or should be working together to help children, are family driven, so that families are partners in everything that happens. And our core values define us. So you should be able to look at our work at Families as Allies and see these core values reflected. And if you don't, I want to know because we want to do better. And these are also the core values that we seek when we're working with the systems that serve our children, for them to reflect as well. And our core, the things that we value are every child and family. So any family who wants to be a part of us and self-defines as having a child with some sort of behavioral challenge is very welcome to be part of us. Excellence, partnership, and accountability. And again, you can see our contact information at the bottom. And we are on Facebook, and we love it when people like us on Facebook. And if you have anything you want to send us by email after this, you can send it to info@faams.org and we'll respond. These are our core beliefs about families that you'll see reflected in this presentation and that will reflect back on as we're talking about different situations that arise. First of all, that families know their children better than anyone. Families are their children's strongest advocates, and that systems should follow laws and policies about families and children's rights. And I'm going to pause for a minute. Does anybody have any questions or thoughts about anything that we've gone over so far? And also for those of you who have not shared your favorite restaurant and your favorite thing from it, you're welcome to do that in the chat. Okay, so we got into our icebreaker, which we've already started, but I'm going to remind you all that we did ask if you would share in the chat box and send it to all panelists and attendees what your favorite restaurant is and what your favorite thing to get is when you go there. And we had a couple people who answered in the question and answers, and I think I may be the only ones who could see that. So we had salada salad at Arbor Walk, which sounds yummy. And then one person shared they just love salads. So we've got some healthy people on here today. Okay, I'm sorry. I was kind of laughing at Anywhere, honestly, on favorite restaurants. Anywhere with a good milkshake. You guys can read these. There's a couple that were sent on all panelists. So Logan's Roadhouse, and I get a steak with grilled vegetables, skewer, and sweet potato with cinnamon and butter. That sounds wonderful. On the salada salads, 100% of the toppings. I like that. See if any of these were sent just to panelists. Okay, lots of yummy things on here. There's one that replied Carnell's 10-piece wing combo. Godfrey's. So lots of good things. Okay, and then there's a few new ones. Okay, shrimp or seafood pasta, nachos. Oh, yum. Olive Garden. Okay, this really is making me hungry. All right, and you guys can continue to share, but we just wanted to have something that we could all, that was probably all on our brain, on all of our brains, and to let everybody, even though it's a webinar, give you a chance to get to know each other a little bit. I don't want to cut anyone off. Okay. You do not have to type your name because it's going to show your name. We're just sharing favorite restaurant. You can just put your favorite place to eat and what you'd like to get when you go there. Oh, Olive Garden, you cannot go wrong with that. All right. Oh, chicken scampi. It is really, I know I keep saying this, but it just makes me hungrier and hungrier to read what y'all write. Okay. All right. So just imagine, and y'all can keep, if you think of something you want to put in there, of course you can. And you are very welcome to put any thoughts in the chat box to share with the group. But just imagine, just looking through there, and I don't think I was the only one that got kind of hungry and started longing for what I might eat later on when I looked at that list. If we could put all that food together and put it together in such a way where we could have one menu at one really great restaurant, it would probably be pretty amazing. And it would probably have quite a lot of stuff on it. It might look something like this. If you can imagine all that good stuff, plus anything else that anyone adds. And then for those of you who are still just trying to think, if we could put all the things you're even thinking of on there, that would probably be a restaurant we would all be very happy to go to. And I'm sure we could all find something that worked for us. One more. It would look like Cheesecake Factory. Is that what? Way too many things on a menu. Yes. This does have a lot of stuff on the menu. Okay. Now, I want you all to keep that favorite restaurant in mind. Oh, and for those, okay, yes. And we will respond to individual questions that you want to send after the webinar for sure. Okay, so I want you to imagine your favorite restaurant. If you could get, maybe you could go to your favorite restaurant you listed and get some of these other things people put in chat, just how wonderful that would be. And just think about, and maybe, for all of us, it's been a while since we've been able to go to our favorite restaurant, and it may still be a while, depending on that restaurant, depending on your individual situation and what works for you and your family. But just imagine getting to that point, even like through this pandemic, and as things get better, which we hope they will, and you're able to go to that restaurant, just how nice that would be to think about going there and getting that favorite thing you really like to get. Now I want you to imagine you're going there and all of a sudden, either there's a lot of road work or there's a bunch of stuff that's happened, or they moved the restaurant and you have to go through all kinds of obstacles and maybe even climb over some walls, go on a bunch of detours to get to this place that's always been probably pretty easy to go to. Now, I know one person put that their favorite restaurant is out of state, so they may feel a little bit like this when they think of getting to it. But what it would be like, you're having this really happy feeling about getting to go to that restaurant. And if there were a lot of obstacles to get there, if it had all of a sudden it had gone to some really hard, out of the way place. And just imagine how that makes you feel compared to how you felt just thinking about going there and getting there a good dinner. And then you think, well, okay, so it got moved, or there's all this construction, or for whatever reason, it's hard to go through, and I may even have to climb over a wall, but that's okay. I'm still gonna get what I want, so that's okay. I can do this. All right, now imagine you're going there and you're expecting that it's gonna be open the hours that it typically was. You know, maybe if it's a place you go for dinner, it's normally open from 5 till 10 or 11. Now we know during this pandemic time and getting our recovery for however long that takes, it might be shorter hours, but that still expecting, yeah, if I go, it's going to be, I can at least get dinner sometime during dinner time, even if I've had to crawl over and I'm a little upset. Now let's just imagine you go through whatever obstacles you had to do to get there. You think it's going to be open. Let's say you're going at 5 or 6, and you get up to the door and you find this. That favorite restaurant where you like to get dinner that used to be easy to get to, now it's only open 3 to 5 p.m. Monday through Thursday, and maybe it just closed right when you got there. How would you be feeling at this point? I'm just going to let y'all respond in the chat. Frustrated? Any other thoughts? Disappointed? Disappointed taste buds, upset, yep. Okay. So I think those really, yeah, one person be waiting outside at 2:40, okay. So it would not be a very happy feeling, especially compared to that feeling you had and was like, oh man, I'm gonna get to go get whatever that really, really yummy thing was. This is a happy time, but it's starting to get very, frustrating. Whoops, I'm sorry. Lost my place. Frustrating, disappointing. Let's see, I think there's one more. Disappointed, okay. So it's not as happy now, but let's just say that you tell yourself, okay. So I've been through a lot, I had to do all this stuff. I'm just gonna come back tomorrow, like one person said, be waiting at 2:40. I'm gonna make this work. I'm gonna get in there. It's gonna be just as yummy as it used to be when I get such and such. And so you go back the next day at 2:40, you're there right when the door opens. You're waiting for that menu that looks like this so you can order your special thing, even though you're gonna eat dinner at 3 in the afternoon. And they give you the menu and it looks like this. Now tell me what you're thinking. Defeated? Disappointed? Yeah, it's kind of going beyond even just frustration. Kind of like, why am I even doing this? Something's wrong. I want an explanation. Gonna go somewhere else. It's confusing. All of those things. Something is wrong. Confused and disappointed. Yeah, very frustrating. Very confusing, very disappointing. And it does feel like it's not just that something went wrong with this day just didn't work out, but that things may not be set up the right way. I think is what some of your comments are starting to reflect. Okay, and let's just decide, well, like I'm here, okay. I can have a hamburger, I can have a hot dog. Hungry plus hangry, hungry plus angry. That's a good one. These people are crazy. Yeah. They don't have things set up right, do they? Okay, so let's say you're like, okay, well, I'm hangry like Henry is. So I'm just gonna go ahead and get either the hamburger or hot dog and, you know, just see how it works, because maybe since they fixed good food before all this stuff happened, maybe my hamburger or hot dog will be good. Now, let's say your waiter comes over and instead of being the warm, now we didn't ask about the service at these restaurants, but a lot of times when people have a favorite restaurant, they also have maybe a server they know, or that servers recognize them, and it's just a warm feeling when they go in. And typically people, they can, but they typically don't pick restaurants as a favorite, really bad service. So let's just imagine you're thinking, okay, I'm gonna get that hamburger or hot dog, and this guy comes up. He looks grumpy. He looks like he's judging you. He looks like he has a lot of other things to do. And then instead of just smiling and greeting you, he starts asking, haven't you had some problems recently? Like you and your kids, like when everybody was having to stay at home, didn't you kind of lose your temper with them some? Did I hear your marriage is having some problems now? What did I hear about you? Okay, now what's everybody thinking about this restaurant? Any additional thoughts? Or maybe what are you thinking about this waiter? Is anybody thinking they're going to leave the restaurant? Find out if it's under new management? Yeah, like what happened? What is going on? And why is it okay to act that way? They need new staff. I'm going to talk to the manager and then call their corporate office. Okay, start working your way up the chain. Done, leave. Yep. Okay, you're going to make a decision with your feet, right? Because why would anyone go to a restaurant where all these things happen? Yeah, this is usually the point at which people are like, I'll just go home and eat Cheerios or Cheetos or whatever I have in my cabinet. Oh, and that's interesting. I'm going to have an attitude of gratitude since everything has been going wrong. That might help change this. Okay, very interesting responses. All right. Now, let's think about that restaurant, or what makes a, well, I'm going to ask y'all, what makes a restaurant good as opposed to what I just described? And I'll give you a few, like a minute or two to, whoops. Sorry, let's go into chat and I went up too high. Customer service, the service, great food and service. Yeah. Because it's about, yeah, a lot about the service and how you're treated as a customer. And also, like someone just wrote, service and product. Do you get what you came there for? And is it a good quality? And that pretty much, yeah, good service, hospitality. So you want to feel like they want you there, not that you're intruding on them. Atmosphere, the ambiance. Those all really capture it. Okay. So this is what we put as qualities of a good restaurant. It has what you're looking for. So if you're hungry for something, it's got it. You guys know I can go to, I forgot where it was that had it. Is it Bam Bam Chicken? You know you can go to that place, or Bam Bam Shrimp, or Boom Boom Shrimp, whatever it was. Looked really good. You know you can go there and you can get that, and it's going to be consistently good. You also know that if you go there one night, and even though it's your favorite thing and you want something else, you can get something else that's good too. So it has what you're looking for. It meets the needs that you have. It's easy to get to. It's not an obstacle course. And maybe it's even at a place you already go to. So I know one example I've seen of that during COVID, and I know not everyone in here lives in Jackson, not everyone on this webinar, but you may be familiar with Broad Street Bakery, and a lot of people really like their bread. They were closed even to curbside service through a lot of COVID up till now. But one thing they did is they sold their bread in a local chain, Corner Market. I think that's a chain that may just be in Mississippi. I'm not sure. So people could still get that bread. And I thought that was really creative of them. And it was also an example of a restaurant making sure their product was really easy to get to. It's there for you at the times you want it. You don't have to go stand in line at 2:40 to get that food you really want for your supper. It's there at a time that works for you. The employees are genuinely interested in what you want, and they realize you could go somewhere else. We can always make decisions with our feet. They're focused on you having a positive experience, and they often will ask you to evaluate their services. And they offer different options for getting what it provides to you. That sentence is a little bit awkward, but what we mean by that is many restaurants, and we really have seen this during COVID because they've had to become more flexible and adaptive. Some deliver, some you could go pick up. Most you could not eat inside of because that would not have been safe, but as things are progressing over the next few weeks, that may become possible. I think it is in some places. And then getting food out to other places that were open, like the example with Broad Street and their bread. And one very interesting thing that happened during COVID is some restaurants started sharing their recipes. There were also restaurants that when they realized they weren't going to be able to stay open during this time, sold the food that they already had or the stuff that they used to make it. So they offered a lot of different options for getting what they had to the people they served. Any other thoughts about the qualities of a good restaurant? Just don't want to leave anyone out. Okay. Okay, so let's just think about these qualities of a good restaurant. And y'all probably know where we're going with this now. Those are also the qualities of family-driven practice. And sometimes people think, oh, well, family-driven practice is something we talk about in the mental health system. That's true. And just looking at the people who are on this webinar today, there are quite a few that are from the mental health system. Of those of you who I know, or I know what the little, your email address, I know what organization it represents. But one thing that was very exciting to me, it is not just people from mental health on this webinar today. It's people from other systems that serve children, which is really exciting. And the idea of family-driven isn't limited to mental health. It's a way of providing, it's a philosophy of how we interact with families and provide support to families that isn't bound by any system. So when we say this is qualities of family-driven practice, that means in any system. And there are some systems that are more likely to use the term family-centered, like you see that in child welfare, sometimes in healthcare. But when you go back and look at the definitions, they're very similar. Okay. And right, Teresa, I see you raised your hand. Oh, and Nicole put that it's important that a place be clean. I think that means that it be a healthy and welcoming place. And I apologize, I do not know when people raise their hands. I don't see how I respond on here. So if you did raise your hand and you want to share something, if you could share it in the chat, that would be really helpful. And I'm also looking for a way to unmute, but I'm not exactly sure. So let's look at the qualities of family-driven practice. And they're basically the same thing as what that restaurant experience taught us. So in any system, if that system is responding and the people in that system are responding in a way that is family-driven, then that system has what families are looking for, even if it changes. And that's what we need to start with in family-driven practice, is asking families what it is they're looking for. What is it that they want? Where do they want their children to end up? And some people will say, well, a family doesn't know what they're looking for. A lot of times that's how the question is being asked. It's not that they don't know. Okay, and Catherine, I like that family-driven is when the family is the driver of the car and the others are the readers of the map, giving directions as the family asks. Okay, that's a good example. So to start with, in asking families what they want, almost all families know where they want their child to end up. What do they want for their child right now, and what do they want for their child in the long run? And to keep in mind, what they want may change. So something that's supportive right now, just like you, even if you love Bang Bang Shrimp, you may not want that for breakfast, lunch, and dinner. It may change what is most helpful to you. One example of that for me is I have a child, he's now almost grown, who has special health care needs. And I've talked a lot about the need for respite, and I wish that he had that, like starting from age 4, that our family had that. I think it would have made a tremendous difference for all of us. That was the one thing I really, really longed for. You know, when he went to college, I didn't want someone coming to me and saying, well, here's some respite he can have now. What we needed then was support with that transition. Okay, and just like a restaurant as services and supports in a family-driven system. And again, that goes across child-serving systems. It's easy to get to. Maybe it's in a place where people already go. And one of the most common ones for children is children are at school. Children are in their home. So services that are flexible and can be offered where children are, and especially like with mental health services, a lot of families would like those where their child's already getting their primary health care. So integrated health care that incorporates both of those things, looking at how to provide support at school and at home if a family wants that. So it's easy to get to. And then for services that are in the community, you know, looking at where they actually are and are those places that families can easily get to, park and things like that. It's there for you at the times you want it. It's really not fair to offer services at the same time that most parents have to work and then see them as resistant or difficult if they're not able to get to those supports at the time that they're being offered, but to look at when they need to be so that they work for families, and asking families for when those times are. And the employees, just like in a restaurant, are genuinely interested in what you want and realize you could go somewhere else. And that those employees are treating families, people they want to have good customer service for, and realizing that they could make a decision to go somewhere else. And sadly, families don't always have a lot of choices, but we should always act in a way as if, well, first of all, creating more choices, and then realizing that families should be treated with the respect and autonomy so that even if there aren't a lot of choices, we should be acting in a way to make what we are offering as customer friendly to them as it can possibly be, focused on having a positive experience, and then asking you to evaluate their service, or that system asks families to evaluate their service, and it offers different options for getting what it provides to you. And think back to that restaurant. Sometimes a family, to get a service for their child, they may want to go to the restaurant. They may want to go to where that service is being provided. Sometimes they might want it delivered, so in-home services, or maybe something that can quickly help, like someone who's at a school who's providing a service, and it could be a healthcare consultation, it could be mental health consultation, where a parent can quickly ask a couple questions to get some support or input on an issue. And then I think one of the most interesting things to think about is those restaurants that have started sharing their recipes. Sometimes as providers, it can be really almost, and I was, before I was in this world, I was a mental health provider, so I know about these feelings. It can feel kind of threatening to share our knowledge or our skills. But many times, and I can definitely say this as a mom, one of the things that's most helpful is if someone who has a lot of expertise will teach me how to do something to help my child, instead of me always having to depend on that professional to provide that service. And there's a lot more things like that that can be done than we typically are willing to think about in the beginning when that concept is introduced. And I actually think the medical system is probably a little further along in helping families learn like medical procedures and those kinds of things that can be done at home, especially with chronic health conditions. But we don't think about that as much in the mental health world, like some of the cognitive behavioral strategies and things like that. What families, that there's probably a number of those that families can learn to do the same types of things that a therapist might do in a weekly session. And one example of that, and I think it's PCIT, where a family does learn, like through wearing headphones and, you know, being there where a therapist is and getting that immediate feedback about things they can do. That's an example of a therapist not hanging on to their skills, but sharing them with a family. So all of these are characteristics of family-driven practice. And again, has what you're looking for, even if it changes, you can get to it. It's there when you want it. Employees are genuinely interested in what you want, and they know you can go somewhere else. And you know, that waiter we talked about asking a bunch of nosy personal questions, it's really important to think about when first interacting with families. And families should think about this too, about how they want to be treated, to not start off with everything that's wrong, but start off with building that relationship so that it's focused on having a positive experience and believing that that family has more strengths than challenges, and that there should always be a way to evaluate the service that your service or support you're offering to families, and that there's different ways, whatever you're offering to that family, to be able to provide that. Okay, so there's a question about how do we help clinical staff understand family-driven practice? That's one reason we're doing trainings like this, and I do think there are several clinicians on here. We have a really diverse group today. So I think just the fact that there's trainings like this where there's providers, there's families, there's policymakers all in the same place, just having everybody in the same place, I think sets the tone for having a really family-driven system of care. Because for one thing, there's the any kind of consumer-driven work, and in which we would put family-driven within that. There should never be a discussion about the group involved without their presence there. So this is a really good starting point that we have all these groups together. I would also, those of you who are providers or administrators in any kind of child serving system, to think about how from the very beginning families can be partners and at the table in whatever's planned. I think it's interesting on this first one about a family-driven system has what people are looking for. One of the most common calls we get, and if you've called us with this, it's really okay. I'm just going to bring this up as an example, is people will have this new program that they're really, really excited about. And usually it's something focused on serving children, which would just make sense. And they will call and they will say, well, we're really having trouble because families don't want to be involved in this. That is one of, as far as practice level questions, one of the most common ones we get. And I've been in that position as a mental health provider. And one thing that was brought up to me when it happened to me, and this is almost always true, is I was asked to stop and think, did I ask the people who that program was intended for? Did I go and ask that group of families if they wanted it? Now, the program I'm thinking of is the first System of Care project we had in Mississippi. We wrote that grant with families. We wrote that grant with every single word of it, with families from families as allies sitting at the table. So I was like, well, yeah, we had families there, but it was a project within Jackson Public Schools and it targeted 2 schools. We didn't have any of the families from those 2 schools at the table. And so their response is, well, we didn't ask you to do that. We didn't say we wanted that. And you know, I really learned a lot from that, and I've still probably made that mistake again, but I don't think I've made it as often. Have we really from the very beginning gone to the people that a program is intended for, an initiative is intended for, and from the very beginning ask them, do you even want this? And if you do, what are you looking for? Because maybe what they're looking for doesn't look anything like what we currently offer. And how would we make sure it has that even if it changes? So those are just some starting points for family-driven practice. Okay, this is the official definition of family-driven practice, and this is from the National Federation of Families for Children's Mental Health. It's used in other systems. It's used in child welfare. It is when you read about family-driven, family-centered practice, like with health homes. In the medical world, it's very similar to this. So this is beyond just how families and family-run organizations have defined it. But think about this in the restaurant. Family-driven means families have a primary decision-making role in the care of their own child, as well as the policies and procedures governing care for all children in their community, state, tribe, territory, and nation. So it's important families be involved, not just that we see them as partners, not just for their individual child, but in everything that happens. So on any policy committee, on when programs are being designed, when programs are being evaluated, and this includes choosing culturally and linguistically competent support services and providers, that restaurant they need to help design the restaurant so that it's serving what they want. Setting goals, designing, implementing, and evaluating programs. One of the best ways to evaluate your programs is to make sure that it's families who are from that same population, evaluating and talking to families, because that's what they'll trust, to find out how they're really experiencing that program, looking at the outcomes, and then families partnering in funding decisions. Families don't want to waste money. We want money spent on what will actually help our children. Families are rarely, if ever, at the table helping make decisions about how money could best be spent to actually help children. But there's not going to be anyone who is more motivated to do that. And these are just some principles, the values that go with that definition. And you can see some of the bolded. Families and youth share and have access to accurate, understandable, and complete information. They define their family composition. Families and family-run organizations engage in peer support. So they're taking the lead in that. It's great that in our state, peer support is starting to be offered in different child-serving systems, but it's very important that that be led by families and family-run organizations. Families and family-run organizations provide direction for policy decisions that impact funding, supports, and services, and a role family-run organizations play is really bringing families together around policy issues. And then this is like what happens if a system is really family driven. So providers, agencies, and systems take the initiative to change policies and practice from provider driven to family driven. So it's one thing to say, yeah, I think this sounds really good and families, should be partners and everything. But if we don't do anything about that, if a provider organization or a system doesn't do anything about that in partnership with the families served by that system, to make those changes, it's not family driven. And that they embrace family driven practice by allocating staff, training, support, and resources to adequately fund and sustain family driven services for children, youth, and families, and the work of family and youth run organizations. You don't look at any other group typically and say, this medical provider or this psychiatrist, they're going to provide this service to us because that's just what they do, and think, well, but they don't need to be paid, or we don't need to put adequate thought and planning and all that into how we will work with them. That'll just sort of happen. It's another area. Family-driven practice is an area of subject matter expertise. Okay, so let me just ask you, and we're getting towards the end, but why do you guys think, why does this even matter? Why does family-driven practice matter, or does it matter? What do y'all think? And I'm going to give you a minute to answer in chat. Does it matter? And if it does, why? It matters because it empowers families and builds community stronger. A family unit is stronger than an individual, and a community is stronger with strong family units. And who knows your family better than you? Okay. So you guys are really recognizing the expertise of families. Okay. And y'all feel free to continue typing your thoughts. I'm going to go to, these were our general areas that we encourage people, and I think your answers are encompassed in this, to think about why does this matter. One is you have improved outcomes, and they are outcomes that are meaningful to families. Because families decided, this is where I wanted my child to end up, and this helped them get there. And everybody who knows me knows I talk a lot about, we want, for a long time, my son and I both wanted for him to be able to go to college and to play baseball. There were a lot of things that had to happen. We got that. Those are the things we wanted. That's what was meaningful to us. It's better use of provider skills and resources, because it really doesn't make sense to have providers trying to offer a bunch of things that families don't want and then getting frustrated because they don't work. And it's better use of funding. Okay. Nothing about me without me, yes. And you guys are I really like your comments that are reflecting that family knows what they want. They know how they live. They know what they want for their direction or future. Yeah, so you're focusing on what they want. You are focusing on outcomes that are meaningful to families. There are some things that can masquerade as family-driven practice, and a lot of times these things can make us feel really good, so it's harder to realize we might be wearing a mask that looks like family-driven practice but isn't quite it, and can lead to some different outcomes. So I'm going to go through those real quick just to share with you some things to think about. One is if you are very focused on how much you care about families. Sometimes people think, well, I'm family driven because I'm always thinking about, how much I care about families and what I want for them and what's best for them. And sometimes when people have that focus, they'll use the word my a lot. Like, I am thinking about my families, and I have this family that, this and this happened. That, and I hope everyone on here cares about families, or else you wouldn't probably be in this world. But you caring about families and that good feeling you get from that, and I'm not trying to step on anybody's toes, but that can be much more about you than them, because it makes you feel good. And that's a starting point to care and have empathy, but it's about what they want. It's not about you caring about them. It's about you supporting them and them getting what they want. And along with that, a related one is seeing yourself as the voice for families, kind of the hero for families, the, diehard advocate that will help them get whatever they want. That again can be almost intoxicating, but if you really think about it, that's focused more on you and you being the hero. And if they know their child better than anyone and they're their child's strongest advocate, why are you doing all that? What are you saying about that if you're doing all that work? And we encourage everyone to think about, it's important to advocate with families, take your lead from them for what they want, as opposed to advocating for families. And just because a family, I like what Catherine said about the map, might not know something like a resource or something, that doesn't mean they can't do something. Share with them that resource so they can use it. You don't need to use that resource for them and assume they can't do things for themselves. This we do a whole nother webinar on, but focusing on family stories rather than their lived experience. It can be, and this happens a lot during the month of May because there's a lot of stories about people's journeys with mental health. There can be a lot of feeling really good because, here's this family who had this horrible thing happened and they overcame and they did this, and that can feel really good, and we can get very focused on, you know, look at all these terrible things that happen, blah, blah, blah. That can also make us put that family in a different category, like they're the family that got rescued or they're the family that we saved, as opposed to looking at them and what their lived experience really tells us, regardless of what their story is. And I'm not wanting to be insensitive to stories, because they have their place. And like I said, we do a whole nother webinar about that. But seeing them as a person that, yes, all those things happen, but look what they were able to do. Look at where they are. What does that mean about their resiliency? And look at the expertise they had about their child and how they used that to negotiate all those things and get to where they are now. That's their lived experience. And that's gives them an area of expertise, just like everybody on this phone call has an area of expertise. And to focus on that as opposed to just feeling almost like a kumbaya moment about the story. Efforts to include families that are different from how other groups are included. And I know probably some of you on the phone have been not like this when we've given you this response. Another thing that we are often asked to do is help a new program form a family advisory board. And our response to that is we typically don't encourage that, because unless a program has an advisory board that's made up of, you know, a lot of different people, including families, that's fine, because some programs just have advisory boards. But unless they're asking for that, families should be on the same committees and on the same task forces and stuff that everybody else is. And if we have their own groups or their own advisory boards for them, we're treating them differently than we're treating other people. And we do a lot of leadership training at Families as Allies, and there's other organizations that do that too, so that families are prepared to be on the same groups as everyone else, but to not separate them on separate groups. Not offering families the same benefits and preparation that other professionals receive when they do system level work. If you invite families to be part of your committees, they should be compensated just like other professionals are, because they're sharing a level of expertise, and we can work with you on that and how things like that can be set up. And assuming that a system or provider organization can take on the role that a family run organization plays in a system of care. Again, a system of care, like at Families as Allies, we're not trying to provide medical care. We're not providing cognitive behavioral therapy. We're not providing, you know, interventions for like that are typically offered in child welfare. We have a unique role, and it is good that some systems and provider organizations are hiring family members. That's great, and that is part of a system of care. It doesn't replace the role, just because, like saying, well, we have, you know, families we've hired. That doesn't replace the role of a family-run organizations and the role we play in bringing families together and doing policy work and technical assistance and those kinds of things. We are at the end, but I wanted to see if there's any questions. And I know that we went through the last part of this pretty quickly. I appreciate all of you being here. And then I'm gonna keep the chat open for questions, and then I'll remind you, these are the things that we said we would, our goals for today, that you'll be able to describe what family-driven practice means, 3 practical ways that it matters, and distinguish between family-driven practice and other concepts that, oh, I apologize for my typo, it's commonly confused with. Oh, thank you, Catherine. So, and I will, keep the chat open for a couple minutes in case there are questions. And I know there was one person that wanted us to send them some information, and we will definitely do that. I really, really appreciate y'all being here today. I don't know, maybe it's because it was Children's Mental Health Awareness Week and we did a lot of different things. I was kind of tired today, and but I am not now. But I was thinking it can be easy to get to Friday and think, oh, I'm not going to do anything this afternoon. So I so appreciate y'all being here. And we are doing this series of webinars on Fridays through the month of May. And then we're looking at June, and we want to do some things around dads and what would most support dads. So I don't know. I know we have some dads out there on this. If y'all have any suggestions on that or ideas, we're very open. And then we do have a follow-up to this, or it's actually standalone and can be on family-driven practice specifically for providers. That's Wednesdays, 3:30 to 5. And we're doing that every Wednesday throughout May, but it's a one-time session. We're just doing it every Wednesday and you can get that information off of our website. And we have a virtual family support group that meets on Thursdays, and it's been meeting at 4:30. And I think this coming week, it's going to meet at noon to give families some different times. So thank you. Thank you. And I appreciate everyone being here. Okay, I'm not seeing any questions. All right, thank you guys. I'm going to go ahead and close the meeting. And y'all have a good weekend. Bye.